Hello, hello. Welcome to Medicare Made Easy. My name is Randall Garcia, and I'll be your guide today as we walk through Medicare. First and foremost, I just want to thank Dr. Porter and Associates for just letting me help the Medicare patients because it's been a privilege to help every single person go through this confusing Medicare process. I've done it so many times. This is my sixth year doing Medicare, and I've just seen time and time again how confused people are when it comes to Medicare. I mean, there's A's and B's and C's and D's, and then there's so many other letters. And how does this all work together? How do I know what plan is good for me? This is what I do. I'm with Premier Insurance Solutions, and we're an independent Medicare agency. So we represent all plans in San Antonio, Texas. So that way, when we meet with anyone who's Medicare eligible and they come to us with their questions and their concerns and their confusions, we're able to first and foremost eliminate the confusion and help people understand Medicare. And second of all, we help them find the plan option that fits them the best. The thing is everyone's different. Everyone's different. And I believe that there's not a one size fits all plan option for everyone. And so when we get clients to come to Premier Insurance Solutions, we are really in it for you. We work for the patient. We work for you to help you find the best option that fits your needs. You know, in fact, you may be aging into Medicare right now. You may be 64, turning 65, or maybe you qualified for Medicare through disability. Maybe you're already on a plan. Maybe you're already Medicare eligible, and maybe you feel like, you know what, maybe I'm paying too much. Maybe my premiums are too high. Maybe my deductibles are too high. Maybe my drug costs are too high. We can actually let you know if that's the case, or maybe there's a better option out there. Maybe you're in a position where maybe the plan that you're on, maybe not all of your doctors take it, or maybe you're developing some chronic conditions as you age, and maybe you need certain types of care, and maybe you need new doctors to choose from. Well, what we do at Premier Insurance Solution is holistic. We look at the patient, and we try to not only help them with insurance, but we try to make sure that we holistically look at the entire patient experience, make sure that they're on the right program, the right insurance, they're with the right doctors, and they're saving the most money. So I love my job. I feel like I'm a professional problem solver because most of the time people come to me with their confusions, with their concerns, with their questions, and I'm really just able to bring light into some of those things. So I'm excited to get started. I want to teach you about Medicare. This is Medicare Made Easy. It's the very, very basics of Medicare, the very, very basics of what you need to understand in order to choose a plan option. This video is not about any specific company. This video is going to be an objective view of how Medicare works as a whole, and I hope it helps you understand how all of this works together. You have to know this stuff in order to make the correct plan selection. So let's get started. Medicare Made Easy. Well, we're going to start with what is Medicare. On this top portion, we're going to go over what is Medicare. And Medicare is, of course, a federal insurance program, and you can qualify it really with two different scenarios. Either you're turning 65 or you've qualified through the basis of disability. So that's important to understand. There's some people that are younger than 65 that have Medicare. In fact, there's many people younger than 65 that have Medicare. So when you get Medicare, you usually will get Part A and Part B in most cases. Let me tell you how that works. Well, Part A, usually, let's go over costs. Part A is usually a 0 monthly premium. And what does Part A cover? Well, Part A, I don't have room to write it here, but Part A is your hospital coverage. And if you have that card, it will say that on your card. It will say Part A hospital. So Part A is your hospital coverage. And what you pay is a 0 monthly premium for that Part A hospital coverage. Well, why do you pay a 0 premium? Well, the reason is because most people have worked in their working lives, or maybe they got it through a spouse, they've paid into Medicare, they've worked their quarters, so to speak, and now they've earned Medicare Part A at a 0 monthly premium. There's some people who may pay a premium if they haven't worked the quarters, but that's a very rare case. Most people will receive Part A at a 0 monthly premium. That's their hospital coverage. Part A is hospital. Part B, this is your medical coverage. If you look at your card, it will say it, Part B medical. And this is for your doctor's visits, your MRIs, CT scans, surgeries, urgent care. Part B is anything medically oriented. So you have Part B medical services. Think of it as like outpatient services. And then, of course, Part A, hospital, inpatient services while you're in the hospital. You see the difference there. So you have Part B, and for 2020, that Part B monthly premium is $144.60 per month. And so you have to pay this monthly premium in order to end up choosing plan options that we're going to talk about in just a few minutes. The Part B monthly premium can actually go up or down based on income. So if you fall below federal poverty levels, this amount might be reduced to even 0 sometimes. But you do have to qualify for those types of programs. Or if you have very high income, there's different categories that can increase this. And there's many different levels of what it can be increased to. But the standard premium that most individuals will pay is $144.60. All right, so how does it work? What happens when I use it? I know what my monthly premiums are, so we're going to put monthly premiums. Let's abbreviate that. Monthly premium. That's your monthly premium. Well, you have deductibles. Does everyone know what the word deductible means? Deductible is what you pay first before any insurance kicks in. So you have to meet your deductible before Medicare pays anything. So you have, and usually these are called annual deductibles. For 2020, the annual deductible for Part A is $1,408. So you have to pay $1,408 before Medicare kicks in and starts paying. That is what you owe in the hospital. You could pretty much almost guarantee that that's going to be your inpatient hospital cost when you go into the hospital with just Medicare. Remember, we're not talking about the plans yet. I don't want you to get confused. Plans will help reduce these costs. We're talking about Medicare by itself, okay? A and B. What happens after you hit your deductible? Well, it kind of gets really confusing because this $1,408 will actually cover your first 60 days in the hospital. And then there's things after it. You might have a $350 copay estimate after day 60 in the hospital per day. And then after a certain amount of days, it's going to go up again. So what I want you to know is this covers your first 60 days. And then after that 60 days, you're going to end up paying very high copays. So plus, I'm going to just put copays, okay? After day 60. After day 60, you have copays. It gets pretty expensive, especially if you have that long hospital stay. Well, Part B, this is really where you're going to be most concerned to make sure we fill the gaps. And the reason is because Part B is everything else. Everything else. This covers doctor's visits, cancer screenings, even cancer treatments, specialist visits, MRIs. It's pretty much everything else, surgeries. And so you have a deductible here of $198. $198. And of course, everyone knows the 80-20 rule. So after you pay your $198 deductible, then it goes 80-20. And you pay 20%. The government steps in and finally pays something. They're going to start paying 80% after you've hit your deductible, and you're left with 20%. The problem with that is that because cancer treatments like chemotherapy, kidney dialysis, or ongoing treatments in those scenarios, they fall under Part B. So you may know somebody, or you may have seen on the news that there's people trying to raise money by selling barbecue plates and doing all these things to help someone with their hospital bills. Maybe they had cancer treatments for a year and racked up three or $400,000 of medical costs. Well, they would have to pay 20% of that, which could be financially devastating to some people. So you've seen those stories, you've heard them, and this is the scary part. We want you to make sure that you're protected and you choose a plan. In fact, this is how Medicare works in a nutshell. There's much more to it, but if you can understand this, you're going to be able to choose your plan option that fits you the best. And there's really 5 reasons going forward why people want to choose some sort of insurance plan. Why someone would want to choose a supplement, why someone would want to choose a Medicare Advantage plan. Why are people choosing plans? Well, you can see some costs here, and I'm going to flip this back just for a second, and I'm going to show you that there's really 5 reasons why people choose a plan. Well, they want help with their deductibles. People want help. They want their deductibles paid, and we'll go over that. The plans that you select will help with your deductibles. Number 2, they want help with that 20%. All right. A lot of you really don't know what those medical bills are going to be if it's a percentage. Like if you just had a percentage type coverage, it doesn't matter what service you get. It's like it's an unknown number. You have to really wait for that bill to come in the mail to know exactly how much you owe. It's kind of a scary thing because you can't really budget for it. You just have to wait for, okay, whatever all those medical services cost, I just know I have a percentage to pay. It's a big unknown factor. So this is scary. We want to help you get with coverage for the 20%. If you notice, Part A is hospital, Part B is medical. But it doesn't say anything about drug coverage. In fact, prescription drug coverage is called Part D. Part D is in dog, and we're going to cover that. Part D, you do need a Part D insurance plan at the very least to cover your prescriptions, or else you'll be penalized for not choosing, at the very least, a prescription drug plan. We don't want you to get penalized, so I can explain how the Part D works. There's several ways to get it. Another reason why people choose an insurance plan is because they want additional benefits. And I'm going to abbreviate this. They want additional benefits. So maybe you have a friend or a family member or a neighbor who has this plan, and this plan includes dental and vision and hearing and transportation and a gym membership, all sorts of things. There's a lot of additional benefits that are included in some plans, not in all plans. In some plans, you might be interested in, you know what, I want to look at the full package. I want my hospital, my medical, my drugs, and some additional benefits. If that's you, you can keep watching because I'm going to explain how that works in just a few minutes. The last thing, last reason why people want to choose a plan is for protection. For protection. And I was just talking about that scenario of the 20%, this enormous cancer treatment bill, or maybe it's a kidney dialysis. Like there's so many scenarios that you can probably think of and use your imagination of the what ifs. And it's not to scare you, it's just to tell you that if something happens, that's what insurance is for, right? Insurance is for protection. And unfortunately, when you're looking at traditional Medicare, there is no annual out-of-pocket maximum. There's nothing that can cap your 20% if something happens. That number can go to infinity, and that is not a pretty thing. It's not something that you're going to think about and smile about. It's kind of scary. So those are the 5 reasons why people might choose either option 1 or option 2. So what's option 1? Well, let me tell you about it. It's called a Medicare supplement. Okay? It's called a Medicare supplement. And some people call this a Medigap. Okay? Medigap, Medicare supplement, these are the same thing. Okay? We're talking about the same thing. There's just 2 different words for it. So a Medicare supplement, there's a few good things about it. Like, for example, these are secondary insurance plans. So if you have your Medicare card, your red, white, and blue A and B card. That would be your primary insurance if you chose a supplement. Then you'd have a supplement, which would be your secondary insurance. It would be your secondary insurance plan. So you have your primary and your secondary. Easy, right? Um, when you have a supplement, there's many letters to choose from, and in fact, I think that choosing your supplement might be best on an individual basis because there's a plan G and a plan N and a plan. There's so many letters, and they're all different coverage. And I don't want to get into the weeds here, but I do want to let you know that you can purchase a secondary that can cover pretty much most of these costs that Medicare doesn't cover. So it's a secondary, it covers expenses, medical services, hospital deductibles that Medicare doesn't cover. So it will fill in some of these gaps. These are age-based. If you go on a supplement and you're 65 years old, you're going to get a premium increase every year. So these are age-based. And that's okay. If you're turning 65, the premiums are quite low. I'm going to give you a ballpark figure. This is not a quote, but for a supplement, you can probably spend anywhere from like $80 a month all the way to about $150 a month for a 65-year-old. And then that goes up from there. If you're 75-year-old, well, those premiums increase a lot, maybe closer to $130 to $200 a month. So when you look at your age, that is a determining factor on how expensive supplements are. But there's really two reasons why people love supplements. It's not because they have high monthly premiums. And by the way, that monthly premium for the supplement might be, or it is in addition to the $144.60. So you continue having to pay this. And of course, like I said, ballpark for a 65-year-old, you're looking at between, well, most of the time it's been between $100 and $120 a month for like a popular plan that's a plan G. Okay. And so what you want to look at is why people pay this extra money. And there's really two reasons, is that there's no network at all. There's no HMO, no PPO. It's no network because you can go anywhere that Medicare is accepted. So that's one reason, no network. And another reason why people love supplements is because there's no referrals, okay? You can go to a specialist without your primary care doctor having to submit a referral. So no referrals. All right. There's one thing that it doesn't have. If you notice there's a plus sign here. There's a plus sign because with a supplement, it still doesn't include drug coverage. So here, you look at a Part D, and on average, you could probably find a Part D for between $20 and $25 a month. And actually, there's some that are a little bit cheaper. There's some that are a little bit more expensive than this number right here. It really depends on your prescriptions. What I would do is a prescription drug analysis, and I would help you figure out, okay, what is the best prescription drug plan for my situation. It's not a one-size-fits-all. It's very custom-made when we work with you. So if you go this route, you have your primary insurance, you have a secondary insurance, and you have a drug plan. You really have three insurance cards: primary, secondary, drugs. And you also have three different monthly premiums: $144.60, whatever your supplement costs, and whatever your Part D drugs premium costs. So that is how a supplement works. There's a lot more to it, and I would say it's best explained in a one-on-one appointment where I would actually be able to look into your situation a little bit deeper. Everyone's different, and figure out what plan option fits you the best. Well, on the other side, there's something called Medicare Advantage. Medicare Advantage, now these are the network-based plans. You've probably heard of Medicare HMOs, Medicare PPOs. Those are Advantage plans, okay? So those are really the main two plans. You have your HMO and you have your PPO. So in San Antonio, Texas, which is where I'm doing this presentation, and of course Dr. Porter and Associates is in San Antonio, Texas. In San Antonio, Texas, we have HMOs and PPOs that have a 0 monthly premium. So I'm going to put that here. That's good news. Now you still have to continue paying your 144.60, okay? So this doesn't eliminate the 144.60. You have to pay the 144.60, and that makes you eligible to enroll into a Medicare Advantage plan at no additional cost. Now you notice I haven't mentioned any insurance companies so far, and I'm really not going to mention a specific plan because I feel like this is this for the sake of this presentation, I want to give you generic information that you can apply to pretty much any plan. And so that's the point of this. I'm not going to mention plans. I'm going to generalize and give you a good idea of what these cover. In general, okay, these HMOs and PPOs are going to be your most popular option in San Antonio, Texas. Statistically, there's more people on an Advantage plan than a supplement. And it's not that one is better than the other. In fact, I have clients who are extremely happy with their supplement. I have clients that are extremely happy with their HMO, extremely happy with their PPO. But why is everyone happy with a different plan? Well, because they chose the plan that fit their needs, right? Everyone's different. So when I go through this, I think that you'll know who you are. I think you'll know which plan that you would like for yourself if you're shopping around. So what is an HMO? HMO is, in other words, is a health maintenance organization. It's a health maintenance organization. And most people really think of HMO as, oh, I need to choose a primary care doctor, and then I can get a referral to go to a specialist, which is true. In HMO plans, you need to choose a primary care doctor, and they will refer you to a specialist. You can't just show up at a specialist without a referral on an HMO. And so some people say, I don't like that because HMOs have referrals. So what their option would be is a PPO. There's no referrals. But there's a cost difference. That's one thing I want you to understand, that there's a cost difference between HMO and PPOs. In general, HMOs will have lower copays. So you're going to look at an HMO and say, wow, these copays and out-of-pocket costs are extremely low. So I'm going to put that next, low copays. And on a PPO, I'm not going to say high copays, but they are higher copays than an HMO in general. Higher copays. Okay? So if you want a PPO, you're going to get the flexibility and freedom of not having referrals, but you will pay higher copays. So there's a trade-off, right? On an HMO, yes, you do have to get the referral. You do have to stay in network, but you're benefiting because you're paying less when you use your insurance. So really, there's two trains of thought. There's the train of thought that says, you know what? I just want low copays. I just want to lower my costs. I'll deal with the referral. You might be an HMO person. Or you say, you know what? I don't want anyone telling me where to go. I want to go where I want to go when I want to go. I'll pay a little bit more for that flexibility and freedom. Well, you might be a PPO person or maybe a supplement person. So there's different perceptions. There's not a right or wrong answer at all. It's just, okay, what kind of coverage do you want to purchase? One more thing is HMOs are very rich, usually, in additional benefits. So some HMO plans have really comprehensive dental coverage, or they have more vision, or they might have certain benefits that the PPO doesn't have. And PPOs historically, and this year for 2020 in San Antonio, Texas, PPOs usually have less dental, less vision. Most of the time, it doesn't include transportation or anything like that. And so what you're doing is you're trying to decide for yourself, which category am I in? Am I going to deal with referrals and go into a network, get referred around, but eliminate costs, get more benefits? You might be an HMO person. Or maybe you're the person who says, I simply want freedom. I want access to the care that I want. I have this many doctors and I want to be able to see them all whenever I want. You might be a PPO person. Just know you're going to pay a little bit more in copays and you will get a little bit less extras. That's okay because to you, flexibility is valuable. Over here, benefits are valuable in the HMO category. It's up to you on what you decide. So beautiful, right? That gives you a good breakdown on how all of this works together. I hope this makes sense. In Medicare Made Easy, I really want you to understand that is really a few more things. Is that Medicare by itself is not usually a good idea. Number one, you first need at least a drug plan, at least a Part D. Oh, by the way, going back to this, both HMOs and PPOs include a Part D at no additional premium. So that reminded me there. You do need Part D coverage. If you just take Medicare by itself and you have no drug coverage, you're going to get penalized. So you at least either need to pay for a standalone Part D, $20 to $25 a month. It could be more or less depending on your prescriptions, or go with an Advantage plan that already includes it at a zero premium. And a lot of people will say, well, how do Advantage plans get, how do they get paid? How do they offer a plan at zero monthly premium? It doesn't make sense, right? Well, the answer to that is the different structures behind the supplement and Advantage. Remember when I told you that your Medicare was primary, and if you chose a supplement, your supplement secondary, and then you have a drug plan, right? Well, Advantage is a little opposite. The reason why they're able to offer zero monthly premiums is because Medicare basically forwards their contract, and the Advantage plan that you choose now manages your claims, now manages pretty much everything, and the federal government is no longer paying the claims or managing your healthcare. It's the plan now. So the money is really exchanged on the back end. You don't see it or you don't feel it other than cost savings. And you'll see that when we walk through, and let's say you're an HMO person, when I walk through an HMO booklet with you and I show you how it works, as long as you understand how the plan works, you're not going to have a problem. You just need to come to an understanding of how this all works together. As long as you understand whichever plan option you're on, it's going to work for you. You're going to know exactly what to do. You're going to know how to solve your problems. And of course, if you have an agent like myself that's working with you, that's even better because you don't have to call a 1-800 number every single time and get someone new on the phone. You actually get someone face-to-face or just a phone call away. You get my cell phone number and you'll be able to call me, text me, email me, and I'm going to remember your case. I'm going to remember exactly what we talked about, what plan you're on, how we selected, why we selected your plan. And if something's not working, we'll make adjustments. But for the most part, my job is to get it right on the first try. I like to think that I'm pretty good at it because I've been doing this this is my 6th year. I've pretty much seen everything under the sun when it comes to Medicare. And I'm confident that I'll be able to help you with your plan options. Now, talking about Dr. Porter and Associates, if you want to come to Dr. Porter and Associates, we need to be very careful on what plans we choose because Dr. Porter doesn't accept all the plans in the entire world. He has certain contracts with certain insurance companies, and we want to make sure that you're choosing a plan that fits where he's in network, where you're not having to pay the full medical bills out of your pocket. So call me if you need any help. What we're going to do is we're going to post my number, my phone number, my name, phone number, everything, my email on the Porter website. You can even call the Porter office and ask for me, and they'll give you my number. If you walk into any Porter office, they should have either myself or a Premier Insurance rep that's ready to help you. We work very closely with the office, and we're excited to help you with your Medicare. But I got to be honest, I don't get excited every day talking about deductibles and copays and premiums. Insurance sometimes is a little boring, but you have to understand it. But what I really love about my job is problem solving, eliminating confusion, seeing that light bulb go off. in my clients' eyes when they finally understand how everything works together and they're comfortable with their plan selection. That's why we do what we do. We want to help you. We want to make sure that that all confusion is eliminated. We want to make sure that you choose the right plan. We want to make sure that you save all the money that you can. We want to make sure that you see all of the doctors that you want to see. We can do that. So I encourage you, reach out to us. Let us know what you need. We're excited to be working with Porter and Associates for 2020 and beyond. And I hope that you have a great year. Thank you.